Okay, it's 6:01, so we can go ahead and we can get started. So my presentation today is on the NBCOT exam and some tips and strategies that you all can utilize when preparing for the NBCOT and when actually taking the NBCOT exam. I'm going to go through these slide by slide. If you have any questions, please do not hesitate to stop me and ask questions. I'm more than happy to answer any questions. If you don't stop me, I'm just going to assume that you're understanding everything that I'm talking about, and I'm going to keep moving forward. Okay, so as a general overview, first we're going to go over some exam tips, then some study strategies, and then towards the end of the presentation, we're going to do an exercise on question analysis, followed by some practice questions. And that's when this presentation is going to become a little bit more interactive, and I'm going to be calling on you guys to answer the questions and put some of those tips and strategies into play. Okay. So with that said, let's go ahead and get started. So my name, for those of you that don't know me, my name is Dr. Kristian Llaca. I am an assistant professor of occupational therapy based out on the Miami campus. All right, so first let's talk about what is the NBCOT exam, right? So it is obviously the National Board for Certification in Occupational Therapy. And passing of this exam is required for OT and OTA licensure. The exam itself is about 3 to 4 hours long, and it consists of about 170 questions. What the exam does is that it tests knowledge as well as clinical reasoning, and it has a pass rate of about 80%, which makes preparation key to being successful on this exam because it is a fairly difficult exam. So let's talk about the test format. It's important to know what the test consists of to help kind of better prepare you for the actual exam. So it consists of a single best answer format in that you're going to get asked a clinical scenario question with 4 multiple choice answers. Some of those multiple choice answers, it's going to ask you to select one, or some of them it's going to ask you to select several answers. What's important to know about the exam and this type of question format is that all of the answers are technically correct, right? So what they're looking for is the answer that is most correct. Okay, so for this exam, you're not going to get any ones that are obviously incorrect. All of them are going to be correct. It's just asking you which is the most correct, and that's going to be based on the actual key information from that question, as well as the type of question that you're being asked. You're also going to get clinical simulation questions where you have to select the best course of intervention. And then based on that selection, then it's going to prompt you to another type of question kind of in that same line of thinking. And then it's going to be a series of questions where you have to answer it based on one specific scenario. And then these questions are all going to consist of 3 key domains. First domain is on evaluation and assessment, where it's going to test your ability to evaluate a patient and select appropriate assessments, as well as interpret assessment results. It's going to ask you questions on the next domain, which is interventions. So you're going to get asked, be presented with specific questions on specific conditions, and you're going to have to select appropriate interventions based on those conditions. You're also going to have to modify interventions based on the information in that scenario as well. And then you're also going to, the exam consists of the third domain, which is professional practice, right? So you're going to get asked questions to determine if you know what's within your scope of practice as an occupational therapist, as well as professional ethics, meaning that you're selecting options that are ethically sound and aligned with the AOTA, their code of ethics. Okay. A good resource to look at the test format is if you go to NBCOT.org, they present you with the blueprint that goes a lot more in depth into those 3 key domain areas. And understanding these domains will kind of help guide your studying as well. So this is a really good resource that you can utilize to look at if you haven't done so already. So as you're preparing for the NBCOT, one of the things that you should obviously do is that you should start with a study plan, right? You should try to aim and carve out 3 to 5 days a week for about 6 to 8 weeks before your exam. Making sure that you're carving out time within those 3 to 5 days to really study all the different areas that are going to be on the exam. One of the best ways that you can do that is use a calendar or planner to kind of map out the different domain and different areas that you're going to study each day. And you should try and focus on the weaker areas first. So this requires you to do a lot of kind of self-reflection and really think back to when you were in school, which of the content areas you're weakest on, and try and start in those areas first. You should also try to take as many practice examinations as you can as possible, and then use the results of those practice exams to identify your areas of weakness as well as your areas of strength. And then again, start by studying the weaker areas first, and then kind of working your way towards areas that you know that you're a little bit stronger in. As you're studying, you want to try and mix content review with practice questions as well, right? Because studying content alone is not enough. You actually want to get practice in these scenario-based questions to help you prepare for what you're going to be seeing on the exam. And then as you're carving out time to study, make sure that you're carving out time to take breaks, right? Because again, it's not good to, study, all day, every day, because that's an easy way to get burned out. And then if you get burned out, it's an easy way to kind of lose interest or kind of lose track of your study habits. So again, make sure that you're taking the time to schedule breaks and taking the time to schedule, family time or gym time or whatever it is that you enjoy doing. Make sure that you schedule that in as part or around your studying schedule as well, to make sure that you're as fresh and as alert as possible when it comes to studying for this exam. So this here are some of the top study resources that you can use as you're preparing for the exam. My personal favorite is the Therapy Ed review book. It's that big green book that a lot of you probably have by now. When I was studying for the exam, that's what I used the most to study with. I read that book from cover to cover. And in my opinion, it's what prepares you the best for the exam. You can also go on the NBCOT website, and they offer study guides. Those study guides I've heard are very helpful. They're very robust. What's good about them is that they're being provided by the actual organization that hosts the exam. So you know that the content is going to be good and it's going to be relevant. If you're a member of AOTA, you can go on the AOTA website, and they also offer examination preparation study guides. Those are also very helpful, although they're not as robust as the Therapy Ed book and as the NBCOT study guides. Some of the resources that I've heard are really good is the OT Miri, right, on YouTube, and the notes that they offer. Those are some really good resources that you can tap into. My recommendation would be that you would supplement OT Miri with some of the other ones that were previously listed, like the Therapy Ed book or the NBCOT study guide. You can also utilize Quizlet flashcards. There are some Quizlets that are already pre-made by other students that were in your same position studying for the exam. Or you can make your own Quizlets based on the material that you're getting as you go studying. I would be careful with Quizlets that were created previously, because again, you don't necessarily know whether or not the information that's on those Quizlets is correct, but still, again, very useful. And then you can also utilize the NBCOT Aspire practice exams. So these are practice exams that you can purchase, and they kind of simulate what the exam is going to be like exactly. So, one of the things that I recommend you do with those practice exam is you take one, try and purchase 3 of them. Take one at the beginning before you start studying to get an idea as to what your baseline is. After you've been studying for a couple weeks, take one in kind of like the middle of your schedule, so you can see kind of the progress that you've made, and then continue studying for a couple more weeks, and then take one more final kind of practice exam to give you a good idea as to where you are headed into your actual exam. Now, some active study strategies that you can utilize. Teaching is a good one, right? Teaching concepts to a peer. This is something that we utilize in clinical practice, right? Having the patient teach things back to you. It's what's known as the teach back method. And the idea behind this is you really know something, or you will really know something. You'll be an expert in something when you have the ability to teach it to someone, right? So the same thing goes for NBCOT material. If you're part of a study group, you're studying with other students that are taking this exam, teach the material and teach those concepts to each other, and you'll see how much easier it is to retain that information. You can also utilize whiteboards to diagram conditions and interventions, right? So mapping out the conditions to the different interventions that are appropriate for those conditions can be very helpful for retaining that information. When you are studying and you're doing practice examinations, try and practice with time limits. So the ideal time limit per question on the NBCOT exam is about 90 seconds per question. So kind of use those parameters or even a little bit less to kind of study and be able to answer those so that when you get to the exam, you're more than prepared to get through all of the questions with more than enough of your allotted time. Visual charts also help. So making visual charts for splints and developmental milestones, having something tangible that you can look at will help you to kind of retain that information a lot easier. And then same thing as using mnemonics, right? So there are plenty of mnemonics out there that are already created that you can utilize and tap into to help memorize information. Now, granted, this examination, the way that the questions are worded are meant so that you really can't rely just on memorization in order to be successful. However, some of the concepts like your milestones or your developmental reflexes, or even like your cranial nerves, those you can utilize mnemonics to tap into and remember specifically what those different things do. And then you can tie into the concepts as to how to go about actually treating or applying interventions for those different concepts. Another thing that you want to try and utilize as you're studying is try and do practice questions daily, right? So even if when you're doing your content review, set aside time to do at least 25 to 50 questions per day. And then when you're answering those questions, focus on the rationales, right? Focus on why the answers are right and focus on why the other answers are wrong in that same question, right? And if there's something that you don't understand, if you don't understand the rationale as to why something is incorrect versus all of the other ones, go back and make sure that you review that in your content, right? That's a great strategy to utilize, and it's one that I did personally when studying for the exam. And then you'll see if you follow that strategy, applying it to 25 to 50 questions a day, by the end of your 6 weeks of studying, you'll see just how far you've come and how much you understand as it relates to content in the NBCOT. As you're going through your practice questions, make sure that you're reviewing your answer patterns and tracking progress. So that way that you're aligning your practice questions with the different content areas that you're studying that week. And that way you move yourself forward into different content areas and you don't lose track as to content that you've already covered versus content that you need to cover. And I spoke about this already, but try and simulate full examinations at least twice. I recommend 3 times, one at the beginning, one at the middle, at the end. If you feel that 3 times is too much, then definitely at least twice, one at the beginning and then one at the end to kind of gauge where you're at in terms of NBCOT readiness. Some other test taking strategies, right? So read all of your options before answering the question. As you're reading the different options, again, make sure that you read them carefully because a lot of the times there are filler words that are kind of thrown in there and meant to kind of throw you off. So make sure by reading the answers kind of thoroughly, reading all the options thoroughly before selecting an answer, that'll kind of help you to clue you in as to any filler words that might be there. Eliminate any obviously wrong choices. And that way that'll simplify the options that you have available to you. And then from there, you can also prioritize the options. And when it comes to the NBCOT exam, there are 3 things that I want you all to prioritize. The first one is safety, right? The examination, the NBCOT exam is not measuring your ability to be a clinician, right? They aren't measuring your ability to be a great clinician. They're not even measuring your ability to be a good clinician. What the examination wants to do is to make sure that you're going to be a safe clinician. It wants to make sure that whatever options you're selecting, that it's going to be safe and you're going to cause no harm to the patient. So if you are ever stuck on a question and you don't know the answer to that question, look at your options and select the one that's going to cause no harm, right? And the reason for that is because the way that the scoring works on the exam, it's not scored like your traditional examinations where you get points for being right or you get points for being wrong, okay? So if you select the safe option, it may not necessarily be the best option or the correct option, but because it's the safest one, you may still get points for and get credit for it, selecting that one. And that may be the difference between you passing and failing the exam, okay? So again, if you take away one thing from this presentation, safety, safety, safety. Prioritize do no harm when it comes to those, to your answer options. The second thing that I want you to prioritize is ethics, right? So the examination is also making sure that not only are you a safe clinician, but that you're an ethical clinician, that you're not going to go out there and you're not going to break any laws or cause or commit any kinds of billing fraud or any of that nasty stuff like that, right? So when you're looking at the exam and the answer options, think of ethics as black or white, right? You know, and this is going to require you to maybe forget a lot of the things that you learned in fieldwork, right? Because fieldwork is real world type situations. The exam is not real world. The exam is perfect world, right? And in a perfect world, ethics is black and white. You're either ethical or you're not. Okay, so when you're looking at an ethical question and you're looking at the options, the answers, it may seem like it's far-fetched, and you may think to yourself, well, I would never do this in the real world, or that's just not realistic to do in a real world. Ignore all that. Put all of that into the back of your mind, and I want you to focus on, is this ethical? Is this the right thing to do, regardless of it, if it's feasible or not? If it's the ethical, if it's the right thing to do, that's the one that you're going to select and move on. Don't even think about it, right? Those ethics questions they're layups, they're gimmies, okay? So first thing to prioritize is safety. Second thing to prioritize is ethics. Third thing that I want you to prioritize is function and occupation based, okay? The exam wants to make sure that you know the role of an occupational therapist. They want to make sure that you know what you're responsible for when it comes time to your treatment plan and your interdisciplinary care, okay? And that means that we are focusing on increasing participation in desired occupations, okay? So when you're looking at your options, if there's one that aligns with increasing the patient's engagement in their occupation, in their meaningful occupation, as established in that question, that's the one that I want you to select, okay? So where you may see this and where you may be in between some of these, right? You may get a question and an option where you're between, for example, implementing strengthening exercises as your intervention versus implementing an occupation-based activity. Always select the occupation-based activity, right? Because again, that's a trick question to make sure that you understand that you as an occupational therapist, you're going to be engaging and increasing participation in those meaningful occupations versus just doing isolation exercises, which can fall in the same scope as physical therapy or a physical therapy assistant, okay? So again, first thing you're going to prioritize is safety. Second one is ethics. And the third one is occupation-based tasks, okay? And then when you're going through the exam, know when to flag a question and move on, and know when to move on from a question, right? So if you are really stuck on something and you can't deduce from those options the safest one, the most ethical, or the most functional, flag that question and move on and come back to it if you have enough time, okay? And if when going through those same options, you can prioritize it from safety, ethics, and occupation-based. Again, select the one that is safest, select the one that is most ethical, or select the one that is most occupation-based. Do not flag that question. Select those three in that priority, and then move on with your life and move on to the next question. Don't dwell on those. Any questions on anything so far? No? All right, moving on. Okay, so during the examination, make sure that you arrive early and prepared. Make sure that you have a form of ID. You're allowed to take some snacks, so check with your testing center to see what snacks you're allowed. I think it's like a banana or a bottle of water. And make sure that you take layers. Those testing centers tend to be very, very cold. So make sure that you have like a sweater or a jacket or something that you can put on or take off if it's too cold or if it's too hot, okay? All of your testing centers are going to have tutorials on what the process is going to be like. So make sure that you watch that tutorial so that you get comfortable with the testing process prior to you arriving at that facility. When you're taking the exam, make sure that you're managing your time correctly. You should have an internal clock that's going off. And at the top of your exam, it's also going to be an actual physical clock that's timing how long you've done to take the exam and how much time you have left. Again, you should try and average about 1.5 minutes or 90 seconds per question, okay? If you feel like you're taking longer than 90 seconds on a question, again, try and prioritize it, safety, ethics, and function-based. Select that one and then move on. Don't dwell too much on a single question versus prioritizing and finishing the examination, okay? You're allowed to take breaks in the exam as well. So utilize those breaks if you have to. It's a good way to kind of stay fresh and kind of clear your mind. Don't take too long using those breaks because, again, I don't believe the timer stops when on those breaks. And then make sure that you breathe and you stay confident, right? Rely back on and think about your journey. Reflect on the journey that you took to get to this examination. All of you went through OT school. OT school is very hard. The exams that you took in OT school are very hard, right? So you passed all of those, and then you're there sitting in front of that NBCOT for a reason. And just think back to that reason as well, right? Think back that like, hey, you've done all this, you studied all this, you passed all this. Now it's just a matter of kind of proving it by passing the exam. So some common pitfalls that you should try and avoid um, when it comes time to preparing for the exam. Try and avoid overstudying one area and ignoring other ones, right? I know that once you identify your weak areas, students tend to kind of prioritize that one disproportionately to the other ones, and they end up studying that one way more than do the other ones. Again, just because you know that you're weaker in one area and stronger in another one doesn't mean that you should spend all of your time studying the weaker ones and ignoring the areas that you're stronger in, right? You want to try and dedicate equal time to all the content areas to fully prepare for that exam. You should obviously avoid cramming the week of the exam, right? By the time of the week that you're scheduled to take that exam, your studying should be done, right? And you mainly should just be focusing on practice questions to kind of help prepare you for that simulated exam. Not practicing full-length tests is another area where students get in trouble. Again, if you haven't purchased the practice exams yet, or if you haven't taken practice exams yet, make sure that you do find them and you do take them. Because again, there's no way to really fully prepare for this exam without taking one of these full-length practice tests and really understanding what your testing endurance is going to be like and really feeling what it's going to be like to sit there for that 3-hour exam. As you're studying, again, make sure that you don't neglect self-care. Make sure that you don't neglect sleep. Those are important things to avoid burnout, and those are only going to help you to keep your mind fresh and help you to absorb the information that you're learning as you're studying during your content reviews. And I spoke about this a little bit earlier as well. Don't doubt your abilities. Again, you went through OT school. You finished the hard part. The hard part is done, right? Now it's just a matter of putting into play everything that you learned, everything that you spent the last 2.5 or 3.5 years studying for. So, other things that you can do for the exam, mental preparation, right? Visualize your success, use affirmations, keep telling yourself, I'm ready for this, I'm going to pass this, I'm going to do this, right? Keep doing that. Using those positive affirmations can help keep you in a positive mindset and really get you ready for that examination. Try and join a study group for support, right? Again, plenty of your peers and classmates are in the same position that you are. You guys are all studying for the same exam. Join a study group. Try and put a study group together at least once a week. Get together and kind of bounce ideas off each other, right? Because there are some students that may be stronger in areas that you're weak, and you can kind of share information that way and help to shore up areas that you find yourself weakest in. And you can do the same thing for a peer. Talk through your test anxiety strategies, right? So again, when you were in school, I'm sure you had test anxiety for your regular class tests as well. So what did you do to manage the anxiety when it came to those in school exams? Put those same strategies into play for this one, right? And again, this is something that you kind of have to figure out what works best for you. There are some people that utilize, going to the gym as a means of anxiety relief. There are some people that kind of use mental imaging or yoga or deep breathing techniques. Everybody's different. There's no one right answer as to how to best manage your anxiety. You just have to figure out which is the best strategy that works for you. And what's most important is that you put that strategy into play when you're feeling that test anxiety. And then have something to look forward to once you take your exam. Plan something fun for after the test, right? Whether it's a small trip or maybe a nice dinner or just an outing with your friends and classmates that were kind of taking the exam at the same time that you were. Having something to look forward to immediately after your exam will help get your mind off of the exam once you've taken it, and helps kind of relieve you of some of that anxiety that you were feeling before you took it. And here's a final week checklist. So then in that week that you're scheduled to take the exam, review the key charts, tables, and high yield topics. Try to do 1 to 2 full practice tests. Make sure that you sleep well and hydrate. Prep your test day bag. Make sure that you look at the route that you're going to take to get to the testing facility so that there are no hiccups when it comes time to driving there. And once again, trust your training. I cannot emphasize that enough. All right, any questions on any of the material that we've covered so far? No. All right. So now we're going to get into some question analysis strategies, and this is probably the part of of this presentation that's going to help prepare you the most. My goal for this part here is to kind of change the way that you look at questions, to be able to better answer those questions, even if you don't necessarily know what the content is talking about, even if you don't know what the answer is, right? It can kind of help you to really analyze it and figure out and deduce which is the correct answer, regardless of the content that question is asking you for, okay? This is also going to be the interactive portion of our presentation. So I'm going to be calling on you as the participants. So, everybody here has their camera off. So I hope you guys aren't just, I hope you guys aren't away from your computer. All right, so the question analysis strategy that we're going to be going over today is the R2D2 method, right? And what R2D2 stands for is read, reduce, draw, and do, okay? So that first portion, read, what that means is that you're going to carefully read the question at least twice to make sure that you fully understand it, okay? So you're going to read the question twice. Then after that, then you're going to reduce. You're going to look at the question and you're going to go sentence by sentence, and you're going to reduce each sentence to only key phrases and key terms, okay? Once you reduce each sentence to key terms and key phrases, you are then going to draw conclusions between your answers to those key phrases that you simplified in the question. And once you've drawn a conclusion between the answer to those key phrases, then comes the do part, which is where you're going to select that answer, and then you're going to move on to the next question, okay? So once again, you're going to read the question twice, reduce the question to simple key phrases, draw conclusions between answers and key phrases, and then select the answer and move on, okay? This is important to not second guess yourself when it comes time to this, because again, if you selected that answer, trust the process, select that one, don't second guess yourself, and just move on to the next question, okay? Any questions on this method? All right, so let's try it out. I have some practice questions here that we're going to put into play. I'm going to start calling on you all kind of one by one to read the question, put this method, put this strategy into play, and then we'll see how you do. So here's the first question. Stacy, since you wrote in the chat, how about you take this one? Stacy, you there? You available?
Yes, I'm in between a phone call at work, so I'm trying to read it.
All right. How about you read? Can you read it out loud?
Sure.
We'll do our best.
Let's see. A 68-year-old client is recovering from a right CVA and demonstrates left-sided hemiparesis and impaired spatial awareness. The client is being discharged home alone. During a home evaluation, the OTR observes cluttered walkways, a high pile rug in the hallway, and a tub without grab bars. What is the most appropriate initial intervention for the OTR to recommend to promote safety in the home?
Great. All right. So now let's go sentence by sentence, and I want you to pick out the key information. So in that first.
Okay, so in the first sentence, is that what you said?
Yep, the first sentence. What's the key information there?
Okay. Right CVA, left-sided hemiparesis, impaired spatial awareness.
So left-sided hemiparesis, right? That's a big one. What is left-sided hemiparesis and impaired spatial awareness? What does that tell you?
Okay, so left-sided hemiparesis, that means, so it's a right side CVA. So, oh my gosh, hemiparesis. So there is a lack of movement on the left side. I think hemiparesis is the top and the bottom.
Yep, there you go,
okay,
right?
Perfect.
So we got that, right? So now we have to be aware that this is somebody that has left-sided weakness, pretty much, right?
Yes.
All right, so now let's go to the second sentence.
Okay. Well, second sentence, being discharged home alone. So home alone.
And what are we concerned about that?
That they're being discharged home alone and they have left-sided weakness.
which tells us that we should be concerned about
their ability to navigate around the home.
and fall risk, right? Pretty much, right? Their inability to
Yes.
navigate alone, them falling,
Yes.
that's our concern. So now let's go. So now we have left-sided weakness and we have concerns about falls, right?
Okay.
So now the third sentence. What's the key information there?
Let's see. Cluttered walkways, high piled rug in the hallway, and then a tub without grab bars.
Those are all examples of what?
Examples of ways that this could be a huge fall risk, and there may not be the ability to navigate around the home.
Exactly. Great job. All right. So now let's look at the actual question. What's the key phrase in that question?
So, what is the most appropriate initial intervention for the OTR to promote safety in the home? So, initial intervention, safety in the home.
Right. And what does initial intervention mean? In your own
Oh my
words.
gosh. Oh, goodness, I was not prepared for this. Okay, initial intervention meaning the steps that we can do to kind of decrease the safety, to increase safety awareness, I guess.
Right. But what does initial mean?
The first thing that we do.
The first thing, right? So this question is asking you to identify the first thing that you're going to do to promote safety in the home and reduce this patient's fall risk that has a left-sided weakness, right?
Okay. Yes.
All right. So now that we've identified it and we've reduced it to those key phrases, now let's look at the options, at the answers, and figure out which is the best one that aligns with the first thing that you would do to prevent fall risk in a patient with left-sided weakness.
Okay. Do you want me to read them or do you want me to answer it?
So and read them and then answer it and then select an answer.
Okay, so A says recommend the client use a walker with a basket to assist with stability and transport items. B says train the client in safe transfer techniques to get in and out of the bathroom independently. C, instruct the client to remove throw rugs and install grab bars in the bathroom. And then D, educate the client on compensatory strategies for impaired left side awareness. So if we're talking about safety in the home, it would be C.
And not just safety in the home, but what else? Because all of those are going to promote safety in the home, right?
Right. So remove throw rug and install grab bars in the bathroom.
That would be the first thing that you would do, right?
Yes. I feel like no is correct.
And that's your answer.
Oh my gosh.
And that's your answer.
Right? Yes. Thank you. Whew.
And again, this just kind of highlights, because again, A, B, and D, those are correct, right? Those are all things that are appropriate to do with this client. But the question is specifically asking you, what's the first thing that you would do, right? And the first thing that you would do is try and remove the clutter and install the grab bars. Then after that, then you can start having them use a walker to ambulate around the home. You can start implementing safe transfer techniques to get in and out of the bathtub independently using those grab bars. And then you can start implementing compensatory strategies for that left-sided weakness. Great job, Stacy. Thank you.
Thanks.
Can I get another volunteer? Can somebody chime in? Somebody else that wants to go.
I'll go. An OTR is working with a 4-year-old child diagnosed with autism who exhibits strong oral defensiveness, gags with new textures, and refuses most foods except dry, crunchy snacks.
You can read the second part.
Okay, what is the most appropriate intervention to begin improving this child's feeding tolerance?
All right, so now let's go sentence by sentence and let's pick out the key information.
4-year-old with autism, oral defensiveness. I guess it's just one sentence. Gags with new textures. Refuses most foods.
So there's a phrase in there, aside from autism, there's a phrase there that kind of stands out. Can you see which one it is?
I don't know. Between those three about his food habits.
Yeah.
I mean, I don't know. I think they're all really related, so I'm not sure what you're asking of me. Refuses most
So I would
foods, oral
say
defensiveness. Say
oral
both.
defensiveness kind of sums them up, right? Or they're all related, but oral defensiveness kind of sums up the other two also,
Sure, but that's not really a
right?
phrase I use in my life. So I guess I was thinking refuses most foods, but whatever.
Okay. And then now let's go to the actual question.
What is the most appropriate intervention to begin improving this child's feeding tolerance? Use distraction techniques during mealtime to increase intake. Introduce non-food oral sensory play to decrease oral defensiveness. C is implement a reward system for consuming new food textures. And D, provide chewable vitamin supplements to ensure nutritional intake. I would say B.
And that's your answer, right? And again, going back here, right, looking at this phrase that you don't use in your everyday life, right, that oral defensiveness, you're going to come across a lot of those phrases in this exam where you're going to look at these phrases that's like, I've never seen that before in my life. What does it mean what they're talking about, right? But again, if you can kind of take that oral defensiveness, put that into your own words, right? What does that mean? It means that they are, they're apprehensive or they don't like new things going into their mouth. Then you can look at the options and say like, okay, well, which one of those is going to directly address the patient's, ability to take in or adjust their defensiveness to those different textures, right? And again, and that's B. So great job. Who wants to go next?
Hi, can you hear me?
I can hear you.
Okay, sorry. I would like to go next, but I can't because I'm driving. But I had a quick question about that last one, for if that's okay.
Yeah.
Okay, so I just wanted to talk it out with you. So B was the one that said make it like play, right?
Mm-hmm.
And then D, was it D or C? I don't know. The other one was talking about like vitamin supplements.
That's D. Yeah.
Okay, I'm answering my question, I think. But I was like, okay, safety. Obviously, we want to make sure they're getting enough nutrients, but then also like we can't prescribe things, so that's not in our scope, so that's out. But then also that's not in our scope. Period. We don't like, so we don't give them like medicine and stuff. So I just repeated myself. But you see kind of my train of thought.
Yeah. So your train of thought is safety, right? You're thinking of like, well, you're thinking about what's in the best interest of the child, right? But
Yeah.
if we look at that answer, a couple things, you're correct, right? We don't want to necessarily provide chewable vitamin supplements. That's not within our scope, right? Because again, we're not nutritionists, we're not physicians, we don't do that, right?
Yeah.
So you definitely want to be careful prescribing any kind of supplement or any kind of medication. Again, and the other thing to consider is this child, right? It's not like he's not eating, right? He is eating. He's just not eating a variety of different things.
Yeah.
All right. So am I really concerned about his nutritional intake? Is there anything in that question that kind of clues me in as to that his nutritional intake is something that I need to worry about or need to be concerned about?
No, it's all sensory.
It's all sensory type stuff, right? And again, the
Yeah.
other thing to consider is that like these questions, those phrases are all there for a meaning, for a reason, right? There's nothing in there. There's nothing in there that is meant to kind of throw you off. There's nothing in there that was in there by mistake. Everything in there is by design, and they only want you to consider the information that they're giving you, right? So don't talk yourself into it. Yeah, exactly.
Okay.
Don't assume.
That's what I was doing.
Don't assume. Don't talk yourself into anything. Don't think of like, well, if this or this or that or that. No, you'll drive yourself crazy. Again, only consider the information that's being presented to you, because if they wanted you to consider the other stuff, they would have included that in the initial question.
Perfect. One more question that may just be answered by what you just said was, is there ever a time where they're like, think about referring them to a nutritionalist, or think like kind of referring them to a different.
There's going to be questions. There's absolutely going to be questions that want to see that if you can work as part of an interdisciplinary team.
Okay.
With that
and that
said,
would probably be, sorry.
No,
thinking out loud.
It all depends. So it all depends on how the question's phrased, right? So like, for example, if this question was asking you who was the most appropriate referral to make based off, the patient's presentation, that's when you would select the nutritionist or something like that, right? But in this instance, right, this question is not asking you about a referral or who to refer that patient to. It's asking you specifically about the intervention. So meaning if it's asking you to select the most appropriate intervention, that means that one of the answers does align with what you can do in your scope of practice, and they want to know what you're going to do as the therapist.
Love it. That's super clear. Thank you so
Yeah.
much.
Yeah, you're welcome. All right, who wants to go next?
I can go.
Go for it.
A 32-year-old client with a C7 spinal cord injury is participating in inpatient rehab. The client has full head and neck movement, fair shoulder and elbow strength, and impaired hand grasp. Which activity would be most appropriate for the OT to introduce to promote independence and self-care at this stage?
All right, so now, wait, go ahead. So that first
No,
sentence,
you're good.
pick up the key information,
C7 spinal cord injury.
which should tell you what? What's the most important thing to remember about a C7 spinal cord injury?
C7, it's
the biggie. It's the big one.
the big one. Oh, tenodesis.
Tenodesis, right? With C7 comes tenodesis, and with tenodesis comes the ability to
Grasp.
grasp things. That's number one. What's the other key thing that this question is telling you?
That they're in inpatient rehab.
And that's huge, right? Because that means the type of setting that they're in clues you into the type of intervention that it wants you to do, right? Because that means that if this patient's in inpatient rehab, they're no longer acute, right? So
Yeah.
they're more stable, but they're also not home yet, which means that they're not fully independent. So the things that you're going to be working on in acute versus inpatient versus home are completely different things.
For
right?
sure.
All right.
Yeah.
So now let's go to the second one.
They have complete head and neck movement, fair shoulder and elbow strength, and then impaired hand grasp, I think, is the big one.
Is the big one, but that's okay because what do they have?
Tenodesis.
To compensate for that impaired hand grasp. Great. So now let's go to the actual question.
Which activity would be most appropriate for the OT to introduce to promote independence and self-care at this stage? So self-care is a big one, I feel like.
Mm-hmm.
So
And when we're talking self-care, what are we thinking about?
ADLs.
ADLs. What kind of ADLs?
Like dressing.
Like
Or
dressing, yeah.
Toileting, teeth brushing.
Exactly, right? Exactly. Those are self-care, right? Like toileting, toileting, brushing your teeth, bathing yourself, right?
Yes.
So we're looking for an occupation that's in kind of like in that same realm, and one that's going to take advantage of what?
The tenodesis.
The tenodesis, right? So now let's go to our options and see if we can find one that matches up with that.
D.
D, right? So D, brushing teeth using the built-up handles and the tenodesis grasp technique, and that's your answer.
Perfect.
Let's look at it here. Even if you didn't remember, I know you remembered what that C7s have tenodesis. I know you remembered. That's okay. But let's say you didn't. Let's say that you forgot. That was the key kind of takeaway with a C7. Question's asking you for something with self-care. If we look at A, is practicing transfers using a sliding board, is that going to help them with self-care?
No.
So we can eliminate that one. Donning and doffing lower body clothing, is that going to help with self-care?
No.
No. Preparing a sandwich at the kitchen counter, does that help with self-care?
No.
No. Brushing your teeth, does that help with self-care?
Yes.
Yes. So then even everything else is irrelevant. You could forget. You could even forget that he had tenodesis. You would be able to just answer this question just by connecting those key phrases to the key phrases in the answers.
Awesome. Thank you.
Great job. Who wants to go next? Oh, we're on a roll, guys. Who wants to go?
I'll go.
Go for it.
A 22-year-old client with schizophrenia recently discharged from inpatient care is referred to an outpatient OT program. The client is disorganized, has flat affect, and reports difficulty following routines at home. So as a 22 schizophrenia, transitioning from inpatient to outpatient.
Okay.
And so I think it's important to recognize that at outpatient, they're being discharged to home. And I'm thinking of transportation to appointments.
Okay.
And then disorganized, flat affect, and difficulty following routines at home. So then I'm thinking if they're struggling with routines at home, then the routine of getting to appointments might be difficult too.
Okay.
What is the most
Now
appropriate?
no, sorry, go ahead. So now let's look at the actual question.
What is the most appropriate intervention to promote independent functioning in daily routines?
Okay, so now you thought going into this, your first thought was transportation, right? Which is a good thing to kind of think about. How is he going to go to and from appointments? Now, based off that question, right, is there anything there to clue you into as to transportation could be something to consider?
From the question or the answers? I'm sorry.
From the question.
The most appropriate intervention to promote, so we're looking at what's happening at home.
In daily routines, right? It's telling you specifically you want something that's going to promote independent functioning in daily routines. And what are some daily routines?
That would be getting up, getting dressed. It's like a morning routine.
Right, morning routines, right? Bathing routines,
meal preparation.
Yep. And now, what is causing this patient to have difficulty with those daily routines?
They're disorganized.
They're disorganized, right? There you go. So now we need to find something that's going to help with the disorganization in order for them to be able to complete their
routines at home.
Daily routines at home. We got it. So now let's look at the options. Let's look at the answers.
So I would say D, a visual daily schedule.
Incorporating routines and responsibilities.
And
that's your answer, right? Great job. So now let's look at the options. Providing education on medication management. Is that going to help keep him organized with his daily routines?
No, that might be one routine, but not in general, no.
Exactly, right? Exactly. Using a cognitive behavioral approach to explore distorted thinking. Is he having distorted thinking, first of all?
Not from the scenario, no.
Not from the scenario, right? Again, it's maybe something that's common with, clients with schizophrenia. However, this client with schizophrenia isn't having issues with that. He's only having issues with disorganization and the flat affect. If he was having issues with distorted thinking, they would have included that in the question. Okay. So we can eliminate that one right off the bat. Engaging the client in group-based social interaction activities. Is he having issues with social interaction?
It's not stated explicitly. A flat affect might cause difficulties with social interactions, but it's not.
So that's a good way to phrase it. It's not stated explicitly in the question. If it is not stated explicitly in the question, don't even bother considering it. Great job. Who wants to go next? Go ahead. Somebody step up. Don't be shy.
I can.
Go for it.
A 45-year-old client is recovering from a distal radius fracture and has completed 4 weeks of outpatient rehab. The client is a graphic designer and reports difficulty typing, fatigue after 20 minutes of computer use, and concerns about returning to work. I don't see a question, but...
Oh, sorry. The question is, what is the most appropriate intervention to recommend? It's an intervention question.
Okay. So I think the most important keywords would be distal radius fracture, completed 4 weeks of outpatient.
If he's doing outpatient, what does that mean?
That he has recovered enough. He doesn't have to be an inpatient anymore. He's coming like maybe 2 to 3 times a week, depending on what the doctor had said.
Yep. All right, great. So now let's look at the second sentence.
Okay. The job, graphic designer. Well, I guess mainly it would be difficulty typing, fatigue after 20 minutes of computer use, and just concerns about returning to work.
And those are important kind of like red flag words that I want you guys to look at, right? And wherever it says the client reports or the client has concerns, that's mainly what I want you to focus on, right? Because again, they're specifically telling you what you have to work on when it says reports or when it says the client has concerns, right? Because your interventions have to address what the client is reporting and also address their concerns. So now let's look at, again, which one is going to address his concerns about work and help him with his difficulty typing, and his fatiguing with the computer use.
Should I read all the answers?
Mhm.
Okay. A is recommend wrist splinting during typing and upgrade home exercises. B, refer the client to vocational rehabilitation for job retraining. C, perform a job site assessment and recommend ergonomic modifications. And D, discharge the client and recommend follow-up with a hand specialist.
So again, focus on the client's difficulties and their concerns.
Okay, well, they're difficult. So the difficulty is with typing and they get fatigued after 20 minutes. And then their concerns are returning to work. But
So how can we alleviate those concerns about returning to work?
well, I like A because of the recommending of wrist splinting during the typing.
But
And
is
that's
that
already-
going to, and that's great, right? That's great. That helps with the typing. But is that
Right,
going to
but not
help
the
him?
second half.
Not the second part.
So then I
So let's
feel
move on
like
to the next one.
B, refer the client to vocational rehabilitation for job retraining. I feel like that is a good answer.
Okay, that is a good answer, but is that something that you can do, right? Is that an appropriate intervention?
No. Oh, that's right. Okay, the question is intervention based.
Right. Intervention based, right.
Okay, so then it would be C, performing a job site assessment, and then recommend ergonomic modifications so we can see specifically what they're struggling with before we say you need to do XYZ or before splinting or anything.
And that's your answer.
Ooh, cool.
Right?
Thank
So
you.
performing the job site assessment and recommending ergonomic modifications. That's the only one that's going to address both things, the patient's reports as well as the patient's concerns, right? Because the ergonomic modifications is going to help with the fatigue, right? And the job site assessment is going to alleviate his concerns about returning to work. And then for the person that had the question about when is it appropriate to recommend or not, right? Again, so referring the client to a vocational rehab or discharging the client and recommending that he follow up with a hand specialist are those things that, especially the vocational rehab for job retraining, is that something that we can do, right? Is this something that's so difficult that he needs to go to voc rehab for? No, we can do that. This is within our scope of practice. So we want to make sure that we're not essentially outsourcing business to people that are doing the same thing that we can do. And then discharging the client to follow up with a hand specialist for what, right? He already saw a hand specialist. The hand specialist was the one that did the surgery. You have the protocol. He's done 4 weeks of it already in outpatient. So he's obviously progressing because he's getting ready to return to work. Good job. And our last question, who wants to do the last one?
I'll do it.
Go for it.
Okay. A 60-year-old client is 2 days post-right total hip replacement, posterior lateral approach, and is referred to OT for an initial evaluation. The client is alert and oriented, has stable vitals, and is currently restricted to partial weight bearing. The nurse reports the client attempted to get out of bed independently during the night and complained of pain and dizziness. What is the most appropriate action for the OTR to take during the initial session?
All right, so let's go to the first sentence. What's the key information?
I would say the 2 days post the hip replacement, the type of approach, thinking of the precautions, possibly.
So bingo, that's a huge one, right? The
Mhm.
fact that they're telling you posterior lateral approach, that's for a reason, right? And the only reason it could be is for you to consider the precautions,
Yeah.
right?
Mhm.
Okay. What's the other key phrase in that first sentence?
Initial or refer to OT.
For initial evaluation, meaning that this is the first time that you're going to see this patient.
Okay.
Right. So now let's go to the second sentence.
Alert and oriented, stable vitals, but mostly probably partial weight bearing. That's their weight bearing status.
That weight bearing status is important, but there's another one that's important too, right? Why do you think that they're telling you that the client is alert and oriented? Why do you think that matters?
Maybe since they just had the surgery and kind of coming off the anesthesia and things like that.
right? And what are we concerned about? The fact that they just came out of the surgery. They told you about it in the first sentence.
Mm,
What's that key word that they told you in that first sentence that they want you to think about?
The approach, the
Which
posterior,
means
so the precautions.
the
They
precautions.
have
So
no
then,
idea, obviously coming right up out of the surgery.
so they're telling you for a reason. They're telling you this patient is alert and oriented, which means that they can follow their precautions. They can keep their precautions.
Got you. Okay.
So you don't have to worry. So you don't have to worry about a disoriented patient that is unable to follow their precautions.
Okay, got you. Got
Right?
you. Yes.
So now let's go to the last sentence.
The nurse reports the client attempted, so probably the part where it says that they got out of the bed independently and then complained of pain and dizziness.
Okay. So now let's go to the actual question.
Okay. What is the most appropriate action for the OTR to take during the initial session? A, instruct the client in lower extremity strengthening exercises in bed to reduce dizziness. B, educate the client on hip precautions and assess bed to chair transfer with assistance. C, postpone the session until the client can demonstrate pain-free movement. D, recommend a bedside commode and discharge planning based on caregiver availability.
So in that question, before you answer that, in that question, what was the key word?
Initial session.
What does that mean? What do they mean by initial?
Like, what is the first thing that you would do for the patient?
What's the first thing that you would do for the patient? And again, now connect that to the key phrases from the previous sentences.
Okay, so we were discussing the precautions, and they are alert, so they should be able to follow them. But since I guess the previous night they had pain and dizziness, you want to kind of maybe re-educate and then kind of assess from there. So
Okay. All right.
The answer is B.
And that's your answer. B. Educating the client on hip precautions and assess bed to chair transfers with assistance. So looking at it here, right? Instruct the client in lower extremity strengthening exercises in bed to reduce dizziness, right? First of all, will lower extremity strengthening exercises, will that reduce dizziness?
No.
That's not going to reduce dizziness. That's number one. Also, again, is that something that is specific to an OTR or could a PT do that?
Yeah, PT could do that.
Yeah. I'm not saying that we can't do it either, but again, the exam wants to make sure that you are establishing and you're establishing and you're offering the unique services that only an OT could offer, right? So now let's look at C. Postpone the session until the client can demonstrate pain-free movement. Is that something that we want to do?
No, they're probably going to be in pain regardless anyway, and
they're probably going to be in pain regardless either way, right? Exactly. And then it's probably going to make it worse, obviously. And again, our goal is to increase participation. If we postpone the session, right? And again, it's not that the client's refusing, it's that we're determining to postpone it. Is that going to increase participation or decrease participation? Decrease, right? So anything that decreases participation, you can eliminate right off the bat also. And then the last one, recommend a bedside commode and discharge planning based on caregiver availability. What did we say about the status, right? What was in that first sentence? This was our initial eval. So how can we already start talking about discharge planning when this is the first time that we've seen this patient, right? And that's how we end up on B, educating the client on the hip precautions and us also assessing the bed to chair transfers with assistance. And that's it. That's all I got for you guys. Any questions on anything that I covered or anything that we did today?
Are you gonna share the PowerPoint, or can you?
I can't share it actually. I have to ask. I have to figure out a way to share it with all of you guys. I'll talk to Ms. Freilinger about posting it. But if you guys signed up for it, you should have your emails and it'll get sent out to you.
Okay, thank you.
I'm just curious, did you get the questions from like an old NBCOT test, or where did the questions come from today that we went through?
I got them through the Therapy Ed textbook.
Amazing. Thank you.
Yep. You're welcome. Someone wrote in the chat. All right. A lot of thank yous. Yeah, I'm glad I was able to help you guys out. Any other questions? Cool. All right. Well, thanks everyone. Happy studying. Good luck on the exam. I'm going to type in my contact info in the chat if you guys want to email me with any questions you may have or any other study tips or anything else that you may want to discuss. Feel free to reach out whenever. And with that said, have a great rest of your night.
Thank you.
Thank you.
Bye, everyone.